Your pap smear is abnormal? Don't freak out, ladies. Let's break this down and talk about what it means and what the next steps are. Hi, I'm Dr. Sherling. I'm a board certified OBGYN, and I want to educate you on some of the things that I feel like women need more information about. So, what is a pap smear and why is it important? The pap smear is a screening test to see if you could have an abnormality that needs to be treated in order to prevent cancer. It's a screening test, so if it's positive or abnormal, that does not necessarily mean that you have a problem, but it does mean that you need further testing to see if there's an issue that we need to resolve. The entire goal of pap smears is to identify women who have abnormalities that could be a precancerous lesion so that we can treat these issues before they turn into cervical cancer. So the follow-up testing for an abnormal pap smear is called a colposcopy. This is a colposcope, which is a special microscope that we use to be able to look at the cervix. In order to do this, we do a speculum exam where we place the speculum into the vagina in order to visualize the cervix, and then we use special solutions that help us to identify abnormal cells. If potential abnormalities are identified while using the colposcope, the next step is to perform biopsies, which is the definitive test to see if there's an abnormality that may or may not need treatment on your cervix. The pap smear is a screen, which means, hey, we need more information. But the biopsy is an actual tissue sample that can tell us exactly the difference that's going on in your cells and if these changes require treatment. Your test results may show normal cells, so HPV related changes, or sometimes an early precancer. If it's one of these, often we can just follow this with close expectant management. And often in these cases, your body will clear the virus or treat the abnormal cells itself. However, if the biopsy does come back showing more concerning results like CIN2, 3, or AIS, this can sometimes mean that we do need to take the next steps and treat these abnormalities in order to prevent cancer. Most of the time, this means an excisional procedure with a LEEP or a cold knife cone. And your doctor can go over these in much more detail pending your biopsy results and what you need for your individual body. So, ladies, remember, an abnormal pap smear is definitely not the end of the world, but it does need close follow up. Stay proactive, stay informed, ask questions if necessary, and make sure to reach out if you have more questions.